Okay. My son tells me that my English is really not good, but because I move my hands, people get to understand me. So, please, if my hands are not quite clear, stop me anytime, and I will try again. I'm going to talk about the method NAET, that it stands for Nambudripad's Allergy Elimination Technique. It has been developed in 1983 by Dr. Devi Nambudripad in Los Angeles, and it's a method that has demonstrated to be very effective in the elimination of allergies, intolerances, and other conditions. Let me go step by step. And all those conditions are related to an abnormal reaction of sensitivity of the body in front of substances that can be harmless for other people. The tools used to do that reprogramming of the body are acupuncture, chiropractic, kinesiology, nutrition, and Western medicine. Let me start for acupuncture. Acupuncture tells us that the energy flows through the body. And when this flow of energy is free, without disturbances, there is health. This person is in health. When a symptom is shown, it's because an imbalance is produced in that flow of energy. And also acupuncture gives us a tool to work on that energy that flows through the body. The kinesiology, the second tool of this method, is what we use to identify what is producing a blockage in the body energy. When somebody has a symptom, it's because a disturbance in the energy flow has happened. With kinesiology, we can identify which is causing the blockage. And also, we identify the blockage, and we identify also how we have solved it. The chiropractic is the tool we use to remove the blockage from the nervous system, from the spinal nerves. Allopathy, we don't need to deeply know the chemistry of the body, but as much as we know, we have more tools to correct the problem that is being expressed through the symptoms. And the nutrition is the tool we use to make clusters, and then we don't need to work substance by substance, but we can work it by groups. And I'll try to don't go back. Allergies, intolerances, and sensitivities are what have in common is that the body is acting against a specific substance, and in all those cases, the chemistry used by the body is different. When we talk about allergies, we are talking about antibodies IgE. When we talk about intolerances, we are talking about antibodies IgG. But sometimes I eat chocolate and I have a headache, and nobody knows what is the chemicals involved. Or if I eat too much peppers, then my joints, I have pain in my joints. Or somebody, by sweating, gets a rash. Or many other reactions. Or after many hours watching the computer, it's like a blurred, heavy head. Okay. Why it happens to some people and not to some other people? It's because that substance supposed to give us that problem, or, and this is what we think, there is an error in the system's information. In order to work in an organized way, the potential enemies have been categorized. So the potential allergens, we place them in 9 different groups. We can have a reaction in front of something that we eat or drink or lick, or we can have a reaction, and in that area we can find allergy to eggs or to peanuts with an anaphylactic reaction, but we have also stomach acid and burning sensation that is not seen as an allergic reaction. Or we have celiac disease that is more common every day. We can have also a reaction in front of something that we inhale, like fumes or perfumes or chemicals. We can have a reaction in front of something that we touch. Sometimes if I wear not cotton, then my skin gives me troubles. Or somebody can have a reaction when has been bitten by a bee or by a spider, or when after vaccination. I've treated a man that after receiving a vaccination for tetanus had mercury, he was intoxicated by mercury. His joints were pain, and he was for 2 years trying to solve that problem. We found that was mercury, and we were able to change his reaction to mercury. Okay. Some other categories. Infectants. Some people, what happens? Virus, bacteria, parasites are not enemies. Yes, they are. But when a body works properly, it's able to control them. When it doesn't work properly, then doesn't know how to use the defense mechanism to protect yourself. An example, we have a couple. One of them has herpes in the lips, and the other one doesn't have the herpes. Is the virus there? Yes, it is. But not both bodies are acting in a different way. One of them knows how to attack it and eliminate it, and the other just express the symptom, has the blockage. And same happens with parasites or bacteria, molds and fungi. A typical problem in that area is the reaction to damp or the candidiasis that is so difficult to be solved by regular medicine. Also, every day we see more people reacting to radiation or to the cold or to sun radiation. Genetic agents, in this case, I was mentioning before that there is an error in the information. This error in the information can be something new or can be something that I've got from my ancestors. And I have a big advantage working on that because I was born with many allergies. And they were solved by using that method. So I was asthmatic. My grandmother had asthma. Her mother died from an asthma attack. And I'm not asthmatic anymore. So that error in my information, it was genetic. But anyway, it has been solved. And another factor that shows symptoms sometimes are the emotions. Sometimes people, when is stressed, get something in the skin, and it's very clear. Sometimes I had a lady telling me when my boss talks to me, my skin gets red and I need an itchy. Okay, the reaction can be solved, and is not in any of the other categories, but is in this category of emotional factors. Okay, if we, at the beginning, it was, the method started as a combination of acupuncture and kinesiology, and now we are able to do an interpretation in terms of energy and information. What we consider is that the energy blockage is produced by interaction of energy fields. Why do we say that? People here that work with kinesiology know that if I hold a candy in my hand, my muscle can get weak. So I'm without touching, or not even touching, but I'm without eating that candy, my muscle will tell what's happening to me. So with just the interaction of energy fields is giving a reaction in my body. So due to an error in the information, something that is a friend for others is seen as an enemy for me. This error in the system's information can come from the past, and with this method we are able to give information to the body, and adding information will reduce the tendency to chaos. I call it tendency to chaos. When I'm ill, I'm like going disintegrating. No, I'm going to the chaos. I'm able to give information and then recover the health. Now, how do we do it practically? I will talk about cases, but practically, what do? We test just by holding and finding out what's there, and then in present, by holding this information that is blocking my system, we press the back and remove from the meridian system and from the nervous system the blockages in front of that substance. We recheck and find out how this is now a new friend, and let the person be there and learn that it is not an enemy. After doing that, we just need to avoid that presence again in the coming 24 hours, and in most cases, it is enough to change the response of the body in front of that substance. So no more sneezes or cough or whatever in front of pollen or in front of chlorine from the swimming pool. So some cases that I've treated myself is I've been, by the last 10 years almost, 9 years working on that. I've treated more than 1,000 people, and these are some of the nice cases to comment about. Somebody, it was a mom bringing the kid to my clinic, and she came with a big toothache. And she tells me, it is terrible. I know that I have no problems with my teeth because I've been in the dentist lately, and he gave me my ferula to avoid bruxism. And in these days, also, my allergy to plastic is very high, it's very high. I was not treating her, but the son, and I told her, okay, let me just check. Are you using the ferula from your dentist? Yes. 8 hours? Yes. Is it plastic? Yes. 8 hours. With the ferula in your hand, you have toothache. I've corrected in the same day her reaction to the plastic, and sent me a WhatsApp telling the pain is gone. Same happened with another patient that he had an methacrylate injection here to correct the bone in his nose, came again with a headache, and didn't tell me what happened to him, just that came with a strong pain in that area. Because he was a long-time patient, I didn't do formal checking, just went directly to check some specific substances. Plastic was one of them. Told him, correct it. I didn't know what happened before, and when the pain was gone, and next week he confessed to me about this injection of methacrylate in his nose. Okay, let me go fast with others. Psoriasis. I treated a man, 30 years old man, with psoriasis in his back, in his arms. Everything started when he finished his university, went with his dog, with a dog, to his parents' house, that was where he was living, and they told that the dog couldn't stay there. So he said, okay, the dog cannot be here, I'm not going to be here either. So he moved to live with his dog. And the psoriasis started 8 years before he came to see me. Fine. checking what was giving him problems, I found that he was having problems with hormones, animal epithelial, animal fat, and an event. So I treated first the substances and then the problem with his parents. And psoriasis was gone. And I had some other cases of asthma. One of them was a classic because 50-year-old man with asthma and under medication, he had just to take whatever every day and occasionally Ventolin or this kind of thing. And we started to work in order: eggs, calcium, vitamin C, vitamin B, sugar. He started to get better. He started to reduce medication. And okay, finally, we finished with pollens and formaldehyde. But then I had another case with asthma and rhinitis. This lady, a young lady, she was getting rid of the problem, but the problem came back. And again, we look for more treatment combinations. She gets better, and then she goes back. And I didn't know what else to search for, and started to ask her body, and we came to that the asthma was related to an event, but not in this life, but in a previous life. So again, okay, we treated that. Next morning, called me. Now the asthma is gone. I don't have rhinitis. This time the symptom apparently is really gone. So why I wanted to mention this? Because this error in the information can be related to a substance, can be something new, but can be something very, very old. Where is that information stored? There are some published studies about this method. One of them was a study. Okay, I meant in the title, the presentation talks about autism. And what we have seen is that when you treat these allergies in children with autism diagnosis, you can see how their behavior changes and how they stop echolalias, and how you can see how they connect, do eye contact, and depending on the child, depending on the case, you can get stronger improvements. And in 2005 was performed this first study, and now we are in the process of a new study with 1,200 children. But let me. Here are two publications. I just wanted to mention them. One related to autism, and the other one related to peanut allergy. Why autism is so important, or we see it as very important, because the growing rate of the illness is really alarming. Why is happening? I don't know if somebody has the answer. In my opinion, it's not only one factor, there are many factors. There are many new enemies in the environment that are affecting the brain. When we working with NAET, we see that if calcium is blocking my system, I will not absorb it properly. If vitamin B is blocking my system, I'm not absorbing it properly. And then my brain, my nerves are not well fed and are not well built. So that's why it's very important, not only in those cases, identify what is causing the problem, but we have to allow them to absorb that nutrient to be able to have well-fed tissues. Okay, these are the statistics and the study, so you can read it. The present study that is being driven by Nambudripad's Research Foundation, Allergy Research Foundation, is we are participating over 100 practitioners. It's done in a group of 1,000 to 1,200 autistic children between 2 and 10 years old. What we want to demonstrate is the effectiveness in this method treating disorders of autism spectrum. And the study means 38 sessions of treatment, will be double-blind with 4 groups, 2 placebo and 2 treatment groups. And we are aware, we are blind, and we have one perspective. But we are sure that from our perspective, we are being able to move this elephant. There are other ways of understanding the illness and of understanding the solutions. But using this one, we are able to move this elephant. Thank you.
Hello, Yolanda. I wonder, especially since this is an SSE talk, if you'd care to talk more about treating past life, if you'd care to talk about the past life issues for whatever you might have to contribute, and I don't know what that might be.
Okay. No, what we see is I don't have, like normally people who come to my clinic are not looking for past life, so I don't have, so only with some people I can go and propose, let me try to treat you in this kind of events. But we know using kinesiology that we can ask if a problem comes from your birth to now or it comes from before your birth. In the case of this lady, I was asking what kind of, if I was needing to treat a traumatical event, and she told me yes. If it was in this life, and she told me no. In the previous life, she told me, or the body told me yes, and then I asked if it was an emotion related to that, and she told me, well, I've asked desamor. I don't know how you translate desamor. Desamor, not love, loveless, no? Okay, it was loveless, and it was in a previous life where she was a lady also. She was not a masculine being. And when I told her, so I was asking in my mind, and when I have the full solution, I express it verbally to her. When I told her, I find that I have to solve a trauma in a previous life with loveless, and you were a female, and you died by suffocation or something like that, she started to cry immediately. And, okay, I treated, and next morning, what was the solution there? But
I enjoyed your presentation very much. I've had successful experience with this treatment. I'm going to ask you about the event thing, because when I was starting college as a goof-off high school kid and going to engineering school, it was very stressful. At the end of the first semester, I had all kinds of things going, including a little bit of psoriasis. So how do you isolate the event?
Asking. The kinesiology let me ask you everything. So I asked, this event was in your first trimester, quarter, the second quarter, the third quarter. And then when I expect a yes from your body, your muscle will come down. And so I can keep asking. And I can ask you also, do I need more details to be able to treat it? You can need more details, or with looking for just that time could be enough. And
good.
Okay.
I'm going to go back and tell my nutritionist to do it. Yes.
Okay.
Hi, thanks for your talk. So I have 2 questions or concerns. So I've done NAET myself as a patient, 2 different practitioners. The one issue, well, the main issue I had was you go in there, they treat you, and then they say, okay, you don't have vitamin C for the next 24 hours.
Yes.
And I was like, wait, I wasn't prepared for this. We didn't talk about that I was going to avoid vitamin C. Now I can't have any fruits or vegetables for the rest of the day. That means I can't have my lunch. You know, I have a work day. I can't just fast. And consistently I've been seeing that, where they'll treat you and they're just like, okay, avoid all I don't know, something that you're supposed to avoid all vitamin B, and it's just like, well, you need to guide me.
Okay,
You know,
but that's a problem with the person who treated you.
that's a good point.
Okay.
So
Because-
in your in the training for NAET, do they teach you how to do that? Like how to help the clients?
At least I do it. I'm
You
teaching
do.
NAT in Spain,
Uh-huh.
and I normally, to my patients and to the people, I tell them first, the basic nutrients, the 15 basic nutrients, it's better to treat them in order.
Sure.
And in the first day, I give you the list of what that 15 substances are, what you can do and what you cannot do or eat or touch in the following 25 hours. So
Okay.
you are prepared. And
Okay.
sometimes, if we would treat sugar, but you come and tell me, oh no, but I have a party and please don't do sugar to me
Right.
today. Fine.
Got it.
Okay, we could
Okay.
do something else.
So you attempt to address that.
Yeah.
My second question or concern, so kinesiology is the study of movement.
Yes.
But when in the context of NAET, they're using a totally different definition, but the same word, which is using your body's strength as a yes or no answer.
Yes.
Have they done any like medical studies, or are there any published studies on the validity or reliability of using the body's kinesiology as yes or no?
Okay, there is a book, I don't know about the studies.
And I know the book.
Okay,
Yeah.
the Power versus Force.
Okay, no, thank you.
Okay,
Power versus,
no,
okay.
Power versus Force is not about healing or any technique for health. It's more about philosophy and evolution of humanity. And Dr. His name could come to me, but I will come later. But in Power versus Force, he finds that kinesiology is a tool to know the absolute truth. And you can ask about anything, about the level of evolution of a specific emotion or of a specific person, or the level of truth of a specific chapter of this book. So
Maybe look there for some references.
Yeah.
Okay, thanks.
Great. Let's give Yolanda a great round of applause for a great talk.